there, and welcome to my channel. My name is Ihekagu, and for the next 2 weeks we're going to be talking about fertility. If you're interested in this topic, or if you know somebody that has been trying to get pregnant and is failing to understand what fertility really is, and they don't know how to understand their body, they don't know how to calculate ovulation, they don't know anything about hormonal imbalance, lost sperm count, anything at all. If you or anybody that you know is going through fertility difficulties, come along, let's educate each other so that we understand what we're dealing with, and let's help each other deal with it better. Without further ado, let's do this. Okay, so the first step we're going to be talking about is understanding your body. Okay, a lot of women don't know their body. So they don't really know what to look out for. You don't know what signs you're supposed to look out for because you don't know anything that is going on down there inside you. Nothing. So the first thing you're supposed to know is, what is a cycle? What is a cycle? Then if you know what a cycle is, you ask yourself, what is my cycle length? How long is my cycle? Okay, how long does it take between this period that I'm having right now and the next period? Okay, how many days does it take? Those days in between, that is your cycle. Then now that I've learned what my cycle is, when do I ovulate? When is my ovulation? Okay, let's say, for example, your cycle length is 28 days. Your period comes 28 days, after 28 days every month. That's a regular period, okay? And then you don't really know how to calculate your ovulation. So in a 28-day cycle, the ovulation is usually on the 14th day. But how can you be so sure that you're actually ovulating on that particular day? There are so many ways for you to calculate it. The first one that I'm going to talk about is you can buy an ovulation predictor kit that you can test with. You can check your basal body temperature. You know, basal body temperature, what is your temperature when your body is at rest, all those things. You'll be checking your temperature like every day until the 14th day. What is your body telling you? How are you feeling? What is going on? Are you having any symptoms? Are you having side pain? You also have to be looking at your cervical mucus. You understand me? Your discharge. What is your discharge looking like at that particular time of the month? Okay, it can be stretchy, it can be egg white, it can be different types of mucus at different cycles, at different times in your cycle. You understand me? All those things we're going to discuss one by one so that you should understand it better. And the next thing you're supposed to do to understand your body is go and run some tests to find out what exactly is going on inside. Okay, what is going on with my reproductive system? What exactly is wrong? You can have hormonal imbalance. You can have fibroids. You can have blocked fallopian tubes. You can have endometriosis. You can have PCOS. You can have ovarian cysts. There are so many things that happen inside that we don't know, that we will not know. You can't know unless you run a test. Okay, so it's important for you to run a test, know your cycle, know everything that is going on inside your body, and deal with it accordingly. Don't be afraid to ask questions. Never be afraid to ask questions. Even, I know that sometimes it can be so overwhelming. You are so, you'll be depressed. You've been trying this for a long time. But then, before you think about getting pregnant, think about dealing with whatever issues you're having inside you. Some people have gotten pregnant, but they've had multiple miscarriages. They don't really know what causes those miscarriages. So what I can advise you is consult a doctor. Sometimes you can have hormonal imbalance in pregnancy, even while you're pregnant. You understand me? Maybe your progesterone can be too high, your prolactin can be too low, too high, whatever it is. People have hormonal imbalance even during pregnancy. It can cause miscarriages, so many things happen inside. So that's why if you get pregnant, if you're this person that has been having multiple miscarriages, what you can do is, the moment you get pregnant, go and run a test to check if your hormones are okay, if everything inside your body is functioning well. Because they say sometimes they don't really know exactly what causes miscarriages, but there's no harm in going to run tests. Do you know the world is developing? The world is developing, and better equipment is coming up. Better tests are being done, and there are better solutions every time. And we're in Africa. Even us that are in Africa, you think there's no solution, but it is there. To every problem there is a solution. The only thing that doesn't have a solution is death, because death is not a disease. You understand me? So that is it for today. I hope you understand this topic, and I hope it reaches you in good health. And I'll see you guys in tomorrow's video. Bye bye for now.